Hello, Team Nila. How are you? Good evening, everybody. Hello. Say hi to me, please. Show me some purple heart. Show me some sunflower. It's nighttime already, but sunflower is still very welcome. Okay, so welcome to the second season of PsychTalks, and this time we are doing it a little bit different. We want to do it via Facebook so that you can easily press like and share so that all of your friends will be able to see it. Okay, if you think this is going to be helpful, by all means go for it. Yeah, so celebrating our return. Okay, this week I think we want to bring in a very special guest who, interestingly, is one of our volunteers, a co-worker. So our volunteer was very excited, go back to work, and they say, wow, doctor, my volunteer group, they actually like to talk a little bit about all these mental wellness, psychology things. Maybe you interested, you can come and do a talk lah. So as a result, this guest came and decided that he want to share a little bit about stress management and how to manage stress effectively. So without further ado, okay, show me the purple hearts while we welcome. All right, we welcome Dr. Lee Cheng. Hello, doctor, welcome. Say hi to our volunteers.
Hello, everyone. Hello. I hope you're taking your dinner.
Yeah, I think they will be eating their dinner
at the same time.
That's their normal.
It's okay. I think that's fine.
So I was just sharing with our audience, that one of our volunteer actually share with you that this is something that she's been through, and I think that volunteer already say hi. Let's have a look over here. Oh, look.
yeah, Catherine. Hi, Catherine.
Catherine. Hello, Catherine. Right, and we see all the volunteers showing you the purple heart.
Yeah, I should have wear a purple shirt. It's too late for me to change, I think.
You want to change? I can.
Other time.
That's right. So, doctor, thank you for joining us today. Because of that, right, we will also send you one of our volunteer T-shirt.
Okay.
To your office, okay? Yeah, thank you for taking your own personal time to do this sharing with us today as well.
No problem.
We really appreciate it. Also, today's topic is about stress, right? What made you want to talk about this, doctor?
I think first thing first, I believe all of us encounter stress one way or another. For those who are working in the office, for those who are working at home, bound to have some degree of stress. And so it's good to talk about it. It's generic, and it doesn't mean that you must do it during COVID. It can be do it anytime. And I was told, Jackie, you told me that most of your volunteers are between the age of 20 to up to about 60 years old, and most of them are working. So I think most of them may encounter some degree of stress at workplace. So I decided today, why don't we talk about stress and maybe focus a bit on workplace?
Oh, I think that will be a very good topic for everyone to learn something today as well. Also, without further ado, I will hand the stage to Dr. Lee, and I will help you to toggle stuff in the back end, okay?
Okay, thank you so much. Hi, everyone. Thanks again to Team Nina for inviting me, and also Catherine, one of my co-workers in the Institute of Mental Health. I have been a psychiatrist for the last 26 years. I've been working in the Institute of Mental Health for the past 26 years. Yeah. So long-time colleague of Catherine, and I think she's very, very into grassroots activities and grassroots work. So I really admire her enthused. The Chinese had this saying, 活到老学到老. So I think we learn from each other. So today, when I'm talking about stress management, I'm also hope to learn from you all, the group of you, the volunteers here. So I was told that we can see the comments at the on my screen, and if I see the comments that there is a question for me to answer, I will try to answer during the time. But we can do it at the end of the day, so-called end of the presentation. By the time we finish, it's also end of the day, or everyone should be sleeping soon. Next, please. Jackie, next, please. Yeah. Okay, great. I think before we talk about stress, I think it's better to know what is mental health. A lot of time, a lot of focus is on mental illness, or we tend to forget about what is called mental health. Mental health is how we look at ourselves, how our lives and the people around us, and we try to evaluate the challenges, the problem, and also see the solutions and the choices we take. So this include how we handle the stress, not only relating to others but also making decisions. Next, please. So when if we don't control our mental health problem or manage it properly, mental health problem will surface. And when mental health problems surface, it may affect our thoughts, the way we behave, our feelings, and also physically our body. And this will result in what we call mental health or mental illness, mental health problem or mental illness. I don't think we want to go into that today. So today we want to mainly focus on how to be more on the preventive side, how to manage the stress before it comes to us. Next, please. So I mean, WHO, which is the World Health Organization, define health is not just the absence of a disease, but also a state of complete physical, mental, and social well-being. So as a doctor, as a psychiatrist, we tend to talk about physical health, which is like any medical condition. We talk about mental health, but it's important that we also talk about the social well-being, especially at this moment where we have social distancing and whatnot. It's also important for us to maintain some degree of social interaction. Like now, I think it's a good opportunity using technology to maintain some form of social interaction. Next, please. By the way, if I'm too fast, you all can always give me a comment because I know now it's already more than 7:45. We do not want to keep you all too late. So I will speak out a little bit because you are tired. Some of you may be having your dinner at the same time. So I want to make sure that don't keep you all until too late this evening. Before we talk about what is abnormal, we need to talk about what is normal. And I think it's just that my height, your height, my weight, and your weight. When we talk about normal, it can be the absence of a illness or absence of pathology, or a average. So most people may average about 1.75, 1.7, the type of thing. But there are people who are very, very tall, 2 meters, and there are people who may be a little bit short. So that is maybe a statistical average, a bell-shaped curve, or ideal norm. Okay, but we also know that normality or normalcy differ from society to another society, and from one time period to another time period. So, for example, in the past, when I was young, when I was a little bit restless, people would say I'm a naughty boy or a mischievous boy. But now people get to know that there's this illness called ADHD, attention deficit. That is not pure naughtiness. That is a form of a psychiatric or mental health issues that we need to address. So people may not know at the time. The society get to know more about it, and then we address that. But we also know that values can change, lifestyle can change. The norms can be also be imposed upon. So what is called normal now, maybe 10 years later, 20 years later, may not be or be deemed to be normal, or maybe deemed to be abnormal, for example. And now we are in COVID, we are always saying that back to normal, but we also say that it may not be total normal because we had to adopt a new normal. I think that's also important. Next, please. So what is stress? As I mentioned earlier on, stress is a common experience in meeting the demand of our life. So when we say we are stressed, it's a state of tension, usually caused by emotional, mental, physical, or social pressure. So it's a multifactorial, it's not really one area. Sometimes patients come see me, they say they are stressed, then we ask them more, we realize that their stress is not only from their work, maybe from relationship, 1 + 1 equal to 2 or equal to 3, because there are more other areas that are stressed and not just a single factor. Next, please. So we say just now, stress can be normal, it serves a purpose. Next. Stress is not always harmful. It gives you the motivation to overcome your difficulties. Next. So good stress. So what are good stress? Good stress make us perform better. Again, in school, if there are totally no exams or no assessment, sometimes you will just be very lazy, we don't do anything. But we give some degree of test or some degree of assessment. We want to make sure that we understand the subject, make sure that we can progress to the next stage. So make us perform better, make us more productive, make us more efficient, and hence make us achieve a better life. Next. Bad stress, however, is not proportionate to the severity of the situation. For example, after the exam, you're still worried. I know you'll be worried about the results. You are worried that it may not done well, but if it happen for the next couple of days, I think maybe we understandable. But it persists for the next 1 month, next 2 months, I think that is not proportionate to the severity of the situation. Or as I said, it continue even when the danger is no longer present. Then you start to continue to feel stressed, and worst of all, it interfere with your social, vocational, or physical aspect of life. So you may not want to interact with people, you cannot work, vocation means your job, or other aspect of life, and that's where what I call bad stress. Next, please. So this is a curve, like I said just now, a normal distribution curve, just our height, just our weight. At the extreme end, you can see that if you have no stress, you may not perform at all. On the screen is on the left-hand side. No stress, you don't perform at all. But the moment you have some degree of stress, you start to perform. But you know there's an optimum level, and this optimum level differ from you and me. Each of us are different. The more we stress ourselves, you'll notice that it's not going up anymore. In fact, it starts to plateau, and then it will start to go down. And when the stress is so high, you can see that the person totally can't perform at all. So this is where I talk about how to manage the stress. Make sure you are in the center, in the average, and not at the too extreme. Next. So what are the stress? Actually, events, a lot of events can cause us stressful. So what are the events? The traumatic events like a natural disaster, flood. Have you encountered SARS before, about more than 10 years ago, I think 17 years ago, and now we are in the period of COVID. Then things that may happen, like an accident, a car crash, or physical assault, like a robbery, or for the female, it will be a sexual assault, or in some countries, there may be man-made disaster like war. I think these are traumatic events. The more traumatic it is, the more stressful we will feel. Next, please. And events are more stressful if they are uncontrollable. For example, the death of a loved one or having a serious illness. This is uncontrollable. The doctor break the bad news. You cannot tahan it. It's uncontrollable. Or unpredictable. I mean, if we can predict the occurrence of a stressful event, we can prepare ourselves, we can control it. But things are unpredictable. For example, COVID is a good example. No one know that end of last year we have COVID, and this COVID lasted even until now. And lastly, challenge our limits. Events cause a change in our life. We require multiple adjustment and readjustment to challenge our limits. So these are more stressful events. Next. So what makes us feel stressed? I talked about just now all the events, but we also know that internal sources can also make us feel stressful. For example, our thinking style. You know, some people are nice to you, you start to doubt them. Why are they so nice to me? Or when you did something wrong, a mistake at work or at school or some form of assignment, you start to blame yourself. You say, I'm hopeless, I'm useless, I'm a failure. I can never achieve anything right. All these are in your mind, your thought processes. Or your social skills, you're too shy, you're too bossy, you're too aggressive. All this make you feel stressed. And lastly, your personality. Next. So, you know, this is just a way we just to talk about type A, type B, and type C personality. It's very layman term. So for a person who is very aggressive, very chiong the type, perpetually very angry, get easily impatient, must get things done very fast. I send you an email, you must answer my email immediately, otherwise you get very, very unhappy. You're type A personality, so you are very, very responsible, overly competitive. That type A personality. Next. The type B is just the opposite. You are laid back, you're calm, you know when to take it easy, you're more relaxed. At the same time, you're introspective, you can think. You will know how to, for example, make use of good sense of humor to calm yourself down. That's type B personality. Next. And type C are the type of person we get very, very concerned because outwardly the person appear to be very calm, very so-called control very well, but it's very agitated on the inside. You know, it's just like our Incredible Hulk. He start to he's a doctor, you know, a scientist, and then when he get angry, he start to burst into a monster type of thing. Suppress anger, hostility, so type C personality. Next. So those are the internal sources of stress. Now we talk about external sources of stress. So external sources of stress for young kids or school-going kids will be from studies. I think that's what we know. Family problems, I think that is again nothing unusual. I mean, each of us has some degree of family problem. And I read the papers recently that some stay at home, you get increase in domestic violence because of some relationship difficulties and interaction between the family members. Then health problems, again, I mentioned just now, uncontrollable, you're being diagnosed to have an illness, be it a physical illness or some form of a psychiatric condition, especially when you're very, very young, you know, you are going to achieve a good career, you just graduated from school and you're told to have some chronic disease, you start to have all these stressful thoughts, you start to feel depressed, all your losses and deployment, this is when you, and when I talk about these losses, most of us thought of the passing on of loved one, and it can be a passing on of your beloved pets that have been with you for many, many years. And earlier on, this evening, I did mention that today we'll focus mainly on work because most of us are working one way or another. So unemployment is something we are aware of now. We know a lot of jobs are being affected. Fortunately, the government is helping us in this area. And for those who are facing unemployment, they definitely have some degree of financial problems. And even you are at work, as I said, just you may also encounter some form of work problem because of the way the work is being designed or the type of nature of the work. I will go into detail in a short while. Next, please. So this is a picture of I obtained recently. Where do millennials work the longest hour? I don't know whether you can see from this picture or not. It appears that Singaporean, young Singaporeans work very long hours compared to some other countries in this study or in this survey. And when we talk about workload, work stress, one can be the workload. Workload means the quantitative basically means the amount of work. Qualitative means is the quality of work. It can be a combination of both. But some people complain that they have underwork. I mean, the Chinese say 大材小用, you know, I mean you can do so much, but my boss don't appreciate me. You only give me such a little work to do, so I can't perform. So I think that is where work underload is a stress to this person. Next. Beside the workload, the other thing is the occupational frustration from things like the role ambiguity. You know, who should I report to? I have multiple reporting officers. I think some of you may encounter that. If I'm being posted, for example, to another department or being temporarily posted to another department, who should I report to? How is my performance being appraised? I think this is something that concerns some of us. The role conflict, because you may, at this moment, you are in charge of this group, at the same time, you may be reporting to another group of people. So the role, basically the job description is not being defined very clearly. For some people, the degree of specialization is also very important because you need to do such specialization work and currently your skills may not be enough. So they require that. Or for that matter, things like poor career development guidance, your boss or your RO or your RO stand for reporting officer or your supervisor were not able to guide you. But I think most time at workplace, and I believe even in relationship, most time the problem arises from poor communication because we do not communicate as well as we want to. We assume that other people understand what we are trying to say. Sometimes we don't read back. We based on the email, we go ahead. But in the end of the day, they say that this is not what I want you to do. I think a lot of times it's based on poor communication. And lastly, I think there's always a degree of what we call bureaucracy, whereby some degree of what we call red tape. And I think this is something that some of us may encounter. Next. And the third area is occupational change. I think, again, that taking COVID, for example, most of us, I will say most of us, have to know how to use Zoom or some form of technological to help us to communicate, whether you're working from home or working on site, because you also need to communicate with each other. Okay? And when you are promoted, that is another stress also, because when you're promoted, your boss will not expect you to do the same work. You're doing the same work, and Marshall don't promote you. Am I right? So promotion carry along your own stress. Relocation, I think you have to relocate, for example, from Singapore, you are relocated to another country. I think you have to get used to the whole culture. You may have to bring your whole family along. Or when an organization is undergoing some form of restructuring, this is something that is also of concern, because it may then be deemed to be redundant, or you may have to go for early retirement. And I mean, some of us do enjoy a break from work, but the moment you go for retirement, you may have to rethink of how you to spend your remaining another 20 years or another 30 years. If you retire at 60 years old, for example. Nowadays, people can live up to 85 years old, 90 years old, even 100 years old. I think we will also be concerned about, do we have enough financial support post-retirement? Okay, I saw some remarks. Do you collect any data on the stress encountered by volunteers? I think I do not have, but I think it's important for us in the first place, Karen, that when you volunteer, you should volunteer according to your wishes. I know some people volunteer because they want to. I know that's like to get the points, so that in school, for example, you have enough some points for you to accumulate. But I think most important is do things that you enjoy, and with that, I think that is important. And some other question they asked is that whether can I have the slides at the end of the day. I'm okay with that. I think I told Jackie, if I'm speaking too fast, and in the end of the day, you may want to digest what the information, I can send you out the PDF copy, not the PowerPoint copy, but PDF copy. You can have my slide, no issue at all. Next, please. Okay, other areas from work stress, with things like noise, the temperature, interpersonal relationship. Again, this is something that some of us have encountered. You're working at home, for example, and your working place, your home place, your home is undergoing some form of renovation, or your neighbors are undergoing some form of renovation. It's very, very noisy. And some of us have complained that because at home, you have to, working from home, for example, you have to switch on your aircon because it's very hot. Singapore temperature is very humid compared to working at office, whereby it's office is in the aircon. I mean, temperature can also play a part. Next. Okay, so this is just a recent, I believe it's Straits Times. I saw the figures work from home, and I thought that is quite useful for us to have a look. And in this so-called diagram, essentially say how many people choose to work from home even after the CB period, after circuit breaker. And you can see that some people want to continue to work from home. About 15% want to continue to work from home up to all the time. 15% want to continue, which means that they are not used to going back to office anymore, or they prefer to at least work from home for the rest of their working and career. And then 3/4 of them say that they over 35% say that they work 3/4 of the time, and then 32%. I think the figure there is quite self-explanatory, and I believe the reason why they work from home because they say that they can get to spend time with the loved one at home. They don't need to think of transport. They need to think of increased flexibility, for example. But at the same time, there are other people who complain that work from home is very stressful because the bosses will continue to kacau them, send an email or any time of the day. Officially at work, 5:30 or 5 o'clock, you can say bye-bye to everyone, say bye-bye to your colleagues. You can switch off your phone, but working from home, sometimes the working hour may not be so well defined. Next, please. Again, this is just findings about where are the stress from working from home. Again, this is a picture that I obtained from Straits Times, I believe. Thanks to the Straits Times for conducting the study. You can look at it and then digest the findings yourself, and then it's quite self-explanatory. Okay, Karen again asked me, is there a direct correlation between stress and mental health? Okay, I will answer your question now. I know I probably later on I will mention about that, but usually what happens is that when we talk of mental health, as I mentioned just now, it's how we look at ourselves, how we cope with the stresses in life, how we interact with people, our social circle of friends. But when stress and mental health, the correlation is if you have vulnerability factors, for example, you are the type who are very worrisome, the type who are very kamchong, the type who are very worried everything, you are very panicky to start with. And if you have a family history of mental health issues and you're not able to cope well even before anything, when the stress starts to strike you, it will break you down, and you may develop a form of mental health issues. Commonly, it's what we call stress-related disorder, but sadly, some people may develop what we call anxiety disorder or even depressive disorder or other form of mental health issues. So it's a what we call a balance. So if you have a no vulnerability factor, you are the type who is very, very shy, like say just now, type B, you are not the worrisome type. Probably the stress will not lead to any form of illness. But again, wherever severe stress, even you are the type who are very, very shy, very, very steady, you know how to control, but a lot of very high stress, unpredictable, uncontrollable, challenge your limit, you may also develop some form of mental health issues. Next, please. I hope I addressed your question, Karen. Thanks for the question. So what happened to your body when you're under stress? You can see that chemicals, substances are being released, your nervous system is being activated. That's why we start to feel kamchong, nervous. We have shaky hand, tremor, we start to sweat, we start to speak very fast. This is what we call the fight, fright, or flight response. So fight means you face it, you will try to handle the stressful problem. Flight means you try to run away, you avoid, you retreat. And then sometimes I tell my patient, retreat is not bad, because at that moment in time you're so overwhelmed, you do not know how to manage it. So maybe it's good for you to take a step backwards, think over it, then tackle the problem. By doing so, you have considered the pros and cons rather than you go straight and fight, and then you realize subsequently that you are not able to manage it. The last one of fright is basically freeze. You do not know what to do. I think essentially when the problem is too severe, you are basically stunned. You do not know what to do. Next. So what should we do when we are under stress? What's the most important thing is we need to recognize that you are under stress. Stress is a process to build. It's more effective to intervene early in the process rather than later. So it's important for us to be aware of the signs and symptoms that suggest that you are under stress. I know some people will say that, no, I never be stressful before. I know how to handle it. And I know y'all at Team Nila like to exercise a lot. I think that's very, very good. I think exercise is very, very important. You keep yourself physically healthy, mentally healthy. I think that's very good. But at the same time, doesn't mean that a person who is a bodybuilder will never get stressed. So you need to understand that stress is a process. It's like just now I mentioned the curve. There will be some symptoms or some signs that you can pick up, or your loved one Because sometimes you also may not identify that you're under stress, but your loved one may be able to identify. Next. So some of the common symptoms of or signs of stress physically, you feel very tired, you feel listless, restless. I mentioned just now the chemical hormones, the nervous system are activated. So you have palpitation. Palpitation means the heartbeat very fast. You complain of physical tiredness, muscle ache, stomach upset, headache, poor sleep. So these are the physical part. So you can observe. If you don't recognize it, other people can see that. Your spouse will say that how come you're not sleeping well, or you keep complaining of stomach ache or body ache, and people will see that. It's usually observable by your loved one or your colleagues. Next. Then the next one is the psychological. Psychological means is your thinking process. Your body, you can't concentrate at work. You have mistake, or the most common thing is people say, "I can't remember. Yesterday my boss told me to do this. I can't remember. Or my wife asked me to buy something. I can't remember." Poor memory, irritability, crying episode, excessive worry, panicky. So you see some symptoms are stretch between physical and psychological. So a person may appear to be panicky, but at the same time, he or she may complain the heartbeat very fast. So there is a cross between, overlapping between physical and psychological. Next. Or behavior. I think these are things again where also can observe by your loved one, your friends. You start to eat poorly, or you start to eat a lot. A lot of people say that I'm stressed, I cannot eat. But but I believe your friends who say that they are stressed, they eat even more. It's the same as sleep. Some people will say that we're under stress, I can't sleep. There are people who say I sleep even a lot. The whole day I seem to be sleeping a lot, but I continue to have no energy. Some people will start to drink alcohol, they consume more coffee, they think that coffee is a stimulant, or they may smoke more, then people fall ill. And there are people who complain of sexual drive reduced, or they become violent outbursts, as you mentioned just now. Domestic violence may appear or may occur at home because of stress. Next. And this is again, just now we talked psychological. This is the thought processes. Again, there's some form degree of overlapping. Irrational thinking, you jump into conclusion easily just because of one mistake. You think that I'm the worst person in life. It's just a computer screen, the maximize button and minimize button. You maximize all your fault. You maximize all your error. You say that I'm the lousiest person in the whole world. How come this small thing I cannot manage? And you minimize your strength. Okay, when someone praise you, say, "Hey, you did a good job." No. This is a simple task. Any person can do it. That type of thing. So you jump to conclusion easily. Or your poor decision making, you are forgetful, you can't concentrate, you have negative thinking. Negative thinking doesn't necessarily mean that you have suicidal thoughts. Definitely when the suicidal thoughts, I think this is very, very important for us to address. But then negative thinking may be things like you start to say, what's the use of doing this? What if this happened and whatnot? Okay, and these are part of what we call thought processes. Next. Lastly, the emotional. Emotional again, irritability, moody, cry, worry, jumpy, feeling overwhelmed. So you notice that it can be a stress can affect us in 5 domains, and these 5 domains will be things like physical, psychological, thought processes with cognitive, emotional, and I think this is where and also the area we mentioned about the earlier on. You may want to go back to the first slides. Can we go back to the thought processes, emotional thought processes, psychological, physical? So remember all these 5 areas. I think this is something, again, once you have the PDF copy, you can look through, and then maybe it can give you some insight into whether you're undergoing some form of stress or not. Please continue. Yeah, continue. Okay, so just now the question about stress and mental health. And stress can also affect physical health. I think a lot of people will tell you that you're under stress, you get high blood pressure, you get heart disease, you get tension headache, and most of us will say under stress, we get ulcer. You get stomach ache, you get stomach ulcer. Some people will have asthmatic attack, the recurrence, or they get body ache, chronic backache, even arthritis. Arthritis means joint pain. Next, and skin condition, low immunity, I mentioned just now, sexual dysfunction. And I think for most of us here, not only the girls, but even the guys, I think we are concerned of premature aging because of stress, or the white hair appear, or you start to lose hair, that type of thing. Next. So again, come back to the workplace. What is the consequences? That's what we talk about. Personal. The consequences is where you go to work, you may have what we call absenteeism. Absenteeism means you don't turn up to work. But I think nowadays there's this thing called presenteeism. Presenteeism means you are present at work, but your mind is not at work. You have mistake. You are thinking at home. You're worried about family. You can't perform. That's presenteeism. It may not be so obvious now when you're working from home because some of our colleagues are not at workplace in the first place. Then we have increase in staff turnover, reduce job satisfaction, and reduce performance and productivity. Next. And consequences to the just now was the organization. What about the work group? With the impact on the individual and the organization, stress-related illnesses also had a major impact on the work groups. Your team group, I think that's very important. I believe your team are very, very united, very cohesive, and Team Nila is the same as a working team. All of us have to work together. We don't work alone. I think we work as a group. So the moment one member is ill, fall ill, other members of the team will have to take on extra duties, extra tasks and responsibilities. I think that is the consequences to the work group. Next. So again, earlier on the question about what we will get when they're under stress, you get acute stress reaction. That's the most common. Otherwise, we got adjustment disorder. Adjustment disorder when you come to a new place, you're not used to it, be it used to the working hours or working timing or relationship problem. And I mentioned earlier on, most common psychiatric conditions are those of anxiety disorder and depressive disorder. Okay, but I also want to caution that when talk about disorder, this is a form of mental condition. But most of us here may have anxiety symptoms or depressive symptoms. This may not amount to a disorder. For example, I say that I feel sad, but my sadness may be just momentary. This is not a depressive disorder, because for depressive disorder, usually the time frame is at least 2 weeks and beyond, and the symptoms are severe. For example, they may have suicidal thoughts or they affect their functioning. So I think we look at the disorder in terms of the symptom, the duration of symptoms, as well as the impact of the symptoms, whether they start to cause us to be not able to perform in our daily role. Next. Okay. Catherine said that skin condition can be eczema. I get it a lot when I'm under stress. I think, okay, she can say that because she mentioned it herself. I cannot say that because if I say that, then become a PDPA issue. Okay, joke aside, I think it's important for us to recognize that some of us when under stress, we tend to scratch ourselves, and then there's some form of eczema. Okay, how do you manage stress? As I mentioned earlier on, you need to recognize the symptom of stress. I told you just now, the physical, the psychological, the emotional, and whatnot. So I think this is something that we need to recognize, that the symptom of stress. Number two is there must be some degree of self-awareness. Be realistic about yourself and others. We know when our limit. Okay, sometimes we want to appear to be friendly, we appear to be nice, we want to be accommodating, but you do know that you may not be able to do all this. I think based on your schedule, you can't. Like today, I accepted the invitation to do this talk. I was told to be a casual, relaxing one. That's why I was even told by Jackie, you can throw in Singlish and whatnot, it's fine. So you don't want to get yourself too stressful. You are self-aware. And the third thing is, do not make too many vital changes in your life at the same time. I think this is very important. You are, for example, you do not want to get married. You do not want to go for a driving car, a test. You do not want to buy a house. At the same time, I think that's maybe too stressful. Or at the same time, pursuing some degree at that moment at the same time. You may want to space it out. Okay, as I mentioned just now, different personality, different people will manage stress differently. You are the type you think you can manage it. You have the self-awareness. You want to do everything together. I think that's fine. I myself, I recall I got my driving test and I got married at the same year. So I think each person may be different. So realize how you manage stress. Next, please. Healthy lifestyle, we mentioned just now, exercise. I think Team Nila is again, you are a group of people who exercise quite a lot, I was told. That's very good. A couple of weeks ago, there this pumping exercise to create awareness. Each of us had to do 25 push-out for 25 consecutive days, and I was doing that for 25 days. But now I lax a bit, so I think I admittedly say that I'm not as good as the team, but I want to emphasize exercise is good. Okay, but exercise again depends on each individual. If you are the type who are just starting, I will encourage you not to do too much because you may sprain yourself, you may injure yourself. At the same time, you are the type who are not able to sleep well at night after vigorous exercise. You may not want to exercise at 9 p.m., 10 p.m., the type of thing. Otherwise, your dopamine, your adrenaline are all flowing in your body. You feel so excited, you can't sleep. Okay, so again, depend on individual. I think you know yourself well better than me or your psychiatrist. I think you should know what time to exercise is the best for you. Okay, enough sleep. I think this is important. Some people always ask me, how many hours do I need to sleep? I will tell them the next day wake up, you feel that you have rested enough. Another day is a day for you, a challenging day for you. I think that's good. But you wake up the next day after sleeping 10 hours and you feel that you are so sincere, you are not energy, you cannot perform, you feel that it's so lousy. I think the 10 hours of sleep is not enough for you. Okay. Earlier on, I mentioned things like anxiety disorder and depressive disorder. Just to give you some hint, if you are the type who's very anxious, very kamjong type, you always tend to have problem with falling asleep. Okay, going to bed, then after that you can't sleep. That is usually for anxious people because you are thinking, you're worried. But for people who are depressed, they usually have problem with maintaining sleep, which means they go to sleep, may not have a problem, but 2 a.m. you wake up, 3 a.m. you wake up, 4 a.m. you wake up. That's not because you wake up to pass urine or whatnot. Or you had diabetes, you tend to have what we call nocturia, waking up to pass urine. Not because of that. That's because of depression. So you encounter someone who has difficulty in falling asleep. Okay, Karen told us that she passed her driving test on the 4th attempt. Okay, but you passed. Congrats. Okay, yeah. So sleep is also important. Yeah, continue, please. Okay. Then eat a balanced diet. I think this again is physical health and mental health is related. We mentioned that in the beginning. No health without physical health, no health without mental health. It's basically together. It's important. And avoid excessive caffeine, sugar. The substance may aggravate your anxiety or insomnia. I think most of us who are anxious and you drink another cup of coffee, you will tell. You will experience feeling very, very anxious. Okay, so I myself sometimes when I drink too much coffee, I also have some degree of palpitation. Okay, great. Next, please. Okay, the next thing is what we'll call time management. Okay, due to time constraint, I'm not able to go into detail, but just suffice to say that we can divide into 4 categories. Each category consists of urgent and important. So one category can be urgent and important. Another category can be urgent and not important. Then it can be important but non-urgent. And the last is non-urgent and non-important. Again, depending on your age, depending on what time you are in our career, most of the things you should be doing should be important but non-urgent. If everything is urgent and important, means you are basically very, very stressed. Mean everything you must chiong, everything you must do fast. It should be important but non-urgent. Not important become urgent. I think that's very, very unwise because that's basically mean that you tend to procrastinate. You wait for things that is not important, but you do it the last minute. Then the deadline then become urgent for you. Okay. So over there some examples of how you should spend your time. For example, some phone calls or some personal activities may not be very important, but it may be urgent for you to handle it. But when you're retired, for example, you have a lot of time to yourself. A lot of things can be non-important and non-urgent. So I think again, this all depends on your age, whether you're working or not, and whether you are also encountering other stressors at the same time. So I would encourage you all to put things into this 4 quadrant, okay, and realize that most of the things are in the important and urgent quadrant. This means that you may not have planned things properly. Okay, most things should be important but non-urgent. Next. Okay, then you should be able to adopt a problem-solving approach. A problem-solving approach, again, we can spend a workshop on what we call problem-solving skills, but suffice to say that what we always say is think of the problem, then come up with multiple solutions. Like I said just now, when you face a problem, you do not want to just fight. You may want to retreat and then think of how to solve the problem. The problem-solving approach is, again, as I said, have the problem, think of the multiple solutions, and each solution thinks of pros and cons, the pros and cons, and pros and cons for A, B, and C. After you do that, you probably have enough plus and minus point to adopt A, B, or C solution, as that's what I meant by problem-solving approach. I know some people say that at that moment I choose A, but years later I may regret. This is not the thing that turned out wise, but none of us are the wiser because none of us can predict the future 100%. Am I right? So, for example, today you see a COE prices being announced. So when you buy a car or you bid for a car, you say, "Oh, this month is a good price." Then next month, the price drop to half of it. Then you say, "Oh, I made a wrong decision." But you are making a solution or coming up with a solution based on the information you have as of now. No one can predict 100% next month, the month after, or even next year. Okay, so I think this is important for us to recognize it. We talked about workplace, we talked about conflict earlier on. So how to manage human relationship conflicts? I think being assertive is important. I told you just now, I explained to you earlier on, while you're trying to be the good person, nice person, accommodative person, you also need to be assertive. If someone keep asking you to do this, do that, you may have to politely inform the person, "Sorry, I can't because I have other commitment." But being assertive is not being rude or being aggressive. I think, again, we are familiar with the difference. Next. Okay, know how to relax, and I think this form of relaxation depends on each individual person. Some people like to write, some people like to paint, some people listen to music, some people go for movies, some people may go for exercise again, some people go for swim, that kind of thing. So different form of relaxation, I think, is important. Whatever suit you. Okay, I always say whatever suit you is the most important. Next. Talk to someone you trust. Okay, speak to a friend, speak to a family member. At workplace, you may want to talk to someone who can give you advice, or supervisor, your RO. When I talk to say a counselor, it doesn't really mean that we must approach a counselor at workplace. Essentially someone that gives you some form of advice. At this juncture, I also like to say that I personally is a free thinker, but people sometimes they have spiritual support, they have religious support, and I think this is as important. You feel that you can speak to your spiritual leader, please proceed, go ahead. I think as long as you feel comfortable, someone give you an advice, and then I think that is something you can trust. Next. Okay, learn to laugh. I mean, laughter is important. I think all of us know that. But I think laughter is also can be quite sensitive. Okay, you don't laugh at other people. A mistake, you don't laugh at people. Physical attribute, that type of thing. So I think learn how to relax, learn how to laugh. It's useful. You can look at comics. You can look at watch a funny comedy show. I mean, and relax at that 2 hours of a movie, that type of thing. Next. Okay, this is we mentioned earlier on before, do not resort to smoking, drinking, overeating. And I, as a doctor, I will always say that do not resort to taking drugs. Okay, for example, you have a sleeping problem, taking drugs maybe can help you for temporary, but a long term, like cigarette, caffeine, or tranquilizer is a sleeping pill, may help you for a short while, but you take it on long term, you get dependent or addicted to the drugs, then you end up having to hold on to the drugs. And I think that is, again, a very unwise decision. Next. So I think lastly, if I'm not wrong, this is the last slide. I will say that if you encounter, after doing all those things, self-management, you can't do it, you can do it, that's good. If you can't do it, or you feel that your symptoms, as I said, is severe, the symptoms are prolonged and start to interfere with your daily functioning, I will suggest you may want to consult a doctor. A doctor doesn't mean necessarily go and see a psychiatrist or a psychologist. You may want to talk to your family doctor who have been treating you all these years since you are young. Maybe he or she also know you well enough, can also advise you some form of stress management skills. But if it's still quite serious enough, he may refer you to see a mental health professional. And again, I want to emphasize that not all mental health professionals first approach you will start drugs or psychiatric medicine. What we usually want to advise the patient is that hope that they again recognize your strength, they can maximize your strength. But if they are severe enough, the condition is severe enough, the condition may require some form of drug treatment, and this may be on a time basis, which means that once you recover, you may not require to continue taking the medication. Next. Okay, these are some of the work from home tips. Again, I believe this is from the Straits Times. Okay, so this is for the employer. I think that for the employer, I think it's important to set a routine, start and end the day as you would at the office. No, sorry, this is for employees. Sorry, employee. Have a designated workstation or workplace to eliminate distraction, update constantly using some form of instant messaging devices, be well prepared for all this virtual meeting and whatnot. I think this is work from home tips for those who are working from home at this moment in time. Next, and this is basically for the employer. Again, this is from the Straits Times, how to reset the expectation of the workers and offer some form of feedback from the workers. Okay, I think this probably is the last slide. Can I see? Yeah, great. Thank you. Are there any questions that we need to address? Hi, Jackie.
I think one question just now. Let me just pull it up. Just give me a minute. Yeah, because just now I think one of our volunteers, Sheila, she asked a question on workplace bullying. How do you manage that kind of stress?
Workplace bullying. I think this is something against the relationship thing. I think this is something that I will personally. I know you've written there, silent killer. Yes, I will personally think that you should surface it out. You should talk to your boss or your RO. I think this it's just a workplace harassment, sexual harassment or harassment. I don't think you should endure it silently. If things do happen, you're being bullied in the form of a harassment, be it sexual or be it some physical, I think you should surface it out. I think the person need to know that this is not tolerable. And for example, in our workplace as a healthcare professional, sometimes our patients or caregiver will be very angry that how come they wait so long to see the doctor or wait so long to get registration, and then some of them may be so-called start to be abusive towards the counter staff or even to the nurses or whatnot. We put out our poster clearly that this we are here to serve. We will not tolerate any form of abusive behavior. So I think not only external people, internally, if your fellow colleagues are bullying you, please surface it. This is not tolerable. This is my personal view. Yeah.
I also agree. I think there are some stuff that between colleagues can do, but then some I think is just cross the line and totally should be eliminated lah.
Yeah,
And there's
and I
another
think
question.
we have to understand sometime between bullying and playing a fool. Yeah, I think again, if you are friends and colleagues, you appreciate like I said, just the jokes or the laughter. You make sure that you are not physically demeaning to the other person. Okay, so I think we exclude that. We exclude those trying to be just purely just maybe just crack jokes and you get offended by it. I think that I will not personally classify as bullying. But if this type of so-called things do happen persistently, and you already tell the person that no, I do not want it to be done this way, then I think I would then think this is more a bullying that rather than a physical trying to be so-called break the ice or trying to relax the type of thing. Okay.
So
How
this
can
is
we?
another question.
Okay.
Supporting your family members, yeah.
I think sadly I think we have read the papers again. This is in the public domain, so I think we can talk about it. The case of the father who killed the daughter because the daughter have a psychiatric illness, and I think only 2 days ago, another lady who killed the son because she's depressed, and then the son has autism and ADHD. I think when we are taking care of people, be it our children, be it our spouse, especially whether they're physical illness or mental illness, it can be very, very stressful. So caregiver stress is something we must not ignore. We don't take it lightly. Okay, and then this thing do happen off and on. It's not common, it's rarely, but I think every time it happens, it just informs us that it is a time bomb. Okay, so when we notice that someone who's taking care of a loved one, again, as I said, a spouse or family members who have some form of physical illness or learning disability or mental illness, we also need to talk about caregiver stress. Okay, so I think the loved one need to come together, help to support. I have family members who complain that it's very stressful. At the same time, they feel guilty to send to a nursing home. So how to support? One way is sometimes they so-called take turns to let the parents stay in different houses, kind of thing. Or some of them who can't, they help to pay for the maid, to employ the maid or come up with some form of allowances to chip in. So I think if we come down, again, this is what we said just now about communication. If we all come together, discuss, we'll know that in fact there's a way to solve the problem. But you don't, you'll think that I'm the only one. Why am I the only daughter or the only son? Just because I'm the eldest or because I'm the youngest, I have to to do everything. Communication is very important. Yeah.
And just now you mentioned that when seeking psychological help, especially from a psychiatrist, just want to emphasize again, right, that Dr. Lee mentioned the first course of treatment is not drugs. It's about recognizing your strengths. So I think regardless anyone from the mental health profession, they are just trying to get you to recognize your inner strengths first, right? And only when the case is severe, like what I mentioned, the type of symptom, the severity of the symptom, and the duration of the symptom, those then will determine whether or not psychological drugs will be administered. Am I right to say that, Dr. Lee?
Yeah. And I also want to emphasize that I always say a drug will have beneficial effects. The drugs also have its side effects. Okay, so when we prescribe medication, a doctor prescribe medication, the beneficial effect must outweigh the side effects. And when there's no alternative, so for example, drug A, the beneficial effect outweighs the side effects. Then drug B is just the opposite. Common sense, the doctor will give drug A and not drug B. So I think this is very important. Every doctor will go through the mind, and I think all patients are supposed to raise the concern, raise the doubts regarding any side effects of the drugs or any misconception about the illness. I think they should raise to the attention of the doctor so that, again, it boils down to, I just mentioned about communication, so that everyone of us understand what is the rationale for starting drug, if need to. Yeah.
Thank you, Doctor. Okay, so just now during the part when Dr. Lee mentioned about this managing stress, right? There were several key points that he mentioned about engaging yourself in physical activity, right? Getting good sleep, as well as trying to look after your nutrition, right? So all these kind of things are actually topics that in Active SG we also have a department called Active Health that they talk about all these as well. So for all the audience out there, if this is something that you would like to strengthen, like try to adopt some habits that will help you to do well in these domains, please go ahead, check out this website over here and start your active health journey. That's where some of the active health coaches will guide you along and share with you some tips how you can improve your sleep quality, do some small changes that will improve the nutrition choices of your meals, right? And also some kind of exercises that that suit your activity level that you can definitely embark on, right? And of course, let me just type something down here. Of course, if this is your first time listening to Team Nila, all right, and you want to know what we are doing, what we are about, and you want to join us, please go ahead and check out this link over here. All right, and you will be able to sign up as a Team Nila volunteer and help us to further this work and empower each other and the community through sport. Right. With that, I want to thank Dr. Lee for joining us this evening. We really appreciate your presence today and sharing all this good knowledge with us.
Yeah, don't mention. I hope it's such some tips. Some of these tips you also can obtain from the Googles and whatnot. But I thought sometimes it's easier, or at least I thought it's more interactional, as in there is a social interaction if you hear from someone than just reading it from the script. As I promised, Jackie, you have my slides. If whoever want it, I let you decide to send a PDF copy to them. No worry about it.
So with the slides, let me just do some adjustment, change it to PDF, and then I will put it up in the comment section. So guys, those of you who have commented you want the slides, you'll receive a notification from Facebook saying that I've commented, and the slides will be there, and y'all can just click and download and then refer to the slides and watch this video replay to cross-reference those slides again. I think that will be very, very helpful for your learning. Again, thank you, Dr. Lee. Thank you, all the audience who have joined us today. All right, we hope you have learned something. And of course, next month when we have our next PsychTalk, then at which point we will share more information with you. But it will still be along the lines of how we can take care of ourselves, how we can prepare ourselves in this very uncertain period of time. Okay, with that, good night, everybody. We'll see you next time round. Bye bye.
Good night. Bye bye.